Military families know how to get the job done right. When you need support with tasks like inbox management, filling out paperwork, or coordinating travel, use Squared Away. Squared Away empowers highly educated military spouses to be trusted remote executive assistants who become part of your team. They work in all U.S. time zones and give you time back to focus on what really matters, making your business thrive. See how Squared Away can support you at GoSquaredAway.com. That's GoSquaredAway.com.
Every day, we rise, challenging ourselves to work for what we believe in. At U.S. Border Patrol, protecting our borders is more than a job. It's a calling. Agents answer the call, working together to keep our country and communities safe. If you're ready for a new mission, join U.S. Border Patrol and go beyond. Learn more at cbp.gov/careers.
Hey everybody, welcome to my Plus Size Grandma Reality Show podcast. This is Coco. I hope you're all having a blessed day and that you are in a good headspace on today. As I am, I'm in a good headspace on today. I'm actually blessed and highly favored. Didn't make it to church, but I'm still blessed and highly favored and still leaning and depending on God. All right, so my thing that we're going to talk about is I'm not approved for weight loss surgery, okay? And it's a few things that weigh in on that, and we'll get into it. We will get into it just as soon as you already know. I ask y'all to please share this broadcast. If you have friends and family members that are struggling with weight loss, or, you know, they gain, they lose, they gain, they lose, and we complain about it because we're obese, and then once we complain about it, you know, we try to do things on our own and nothing works out. Y'all hear me sharing out. Let me cut that off for you. But yeah, so I'm gonna talk about that and what it's like, and just give you a little rundown in the background of how I got to this point. How I got to this point right here that I'm at right now. Okay, so let's get into it. Okay, I had an appointment with my doctor Friday, which was I want to say, well, let me just look on the calendar and telling you. It was January 26, 2024. I had the appointment with my doctor. And this is the endocrinologist and the bariatric weight loss doctor. And I hadn't seen him in about 6 months, he said. It had been 6 months since we seen each other. And I had lost no weight. I gained weight. My total weight gain was 115 pounds. And he was like, "What's going on? Tell me what's going on." And I was like, "I let everybody go." Yeah, I did. I let everybody go except for my primary care doctor. Other than that, I let everybody else go. The nutritionist, I actually had let him go too. But what happened, I had let him go. And I'm going to tell you what happened. I done told my family and all that. I'm not dealing with him because I don't feel like, you know, right now he's helping me. I feel like I'm just going in saying, "Hey, how you doing?" And then going back home. That's how it felt. I didn't, you know, because it's certain things I look for in a doctor that I trust. And right now, my trust point ain't all the way there. Now, could that be anxiety? Could it be all in my head? Or do I have a legit reason to really not be trusting at this moment? So, let's go. After I told him that I was going to let him go too, but then somebody scheduled me for an appointment, and I was like, okay, so let me go to this appointment since it's already there. And when the woman actually called, the secretary actually called, or receptionist, however you want to say it, when she actually called me, I was surprised that I was still even on his roster, because I really did not try to keep in contact or anything with him. So when she called me and she said, you got an appointment coming up January 26th, will you be here? And I was like, nope. And then I was like, no, you know what? Yeah, I'll be there. And I changed my mind right then and there. So let me tell y'all something. First of all, don't let nobody don't let nobody make you think that you don't have a say in your health care. You can approve or disapprove things too, and it's okay to change your mind. If you said something that now later you have changed your mind on it, it's okay. Don't waddle in pity over your decisions, because I talked junk. I said I am never going back to this clinic again because I felt so undervalued as a patient. That's what happened. I felt undervalued, and at that point I was like, you know what, I just need to pull out. But when I got this call, it was different. I had a different unction on the inside of me. And I said, I owe myself the chance to try again. And I knew I had gained weight. I didn't think it was that much, though. I'm not lying. When I said I was shocked in that other podcast, I really was shocked at the numbers, because I knew I gained back the 100. But that extra 15, that 115, that took me over my previous weight that I hadn't been that much since 2007, 2008. I hadn't weighed that much. And that's a hurtful feeling. So I'm glad I did get back in trying to help myself, All right. So I did go to the appointment. After all that, I just said no. And now I'm back in with the appointment with the same doctor. And I go in and we talk and we go over things. And one thing he wanted to know was how was my eating habits. And I had to be honest. I'm still binge eating. And a lot of this is due to, now that I look at it, I would say stress and emotional eating. I just really been stressed out, extra stressed since 2022. I didn't even think it was possible to go back being that stressed as I was, but I did. I fell back into the stress habits of eating and not taking time to really make sure I'm having healthy meals. And I was eating according to my budget, not taking time to see, if there's any cheat meals I can make that are healthy. I did that probably for a month and then I stopped. But we all go through something, and I had been going through a lot trying to get myself back on the right road. And like I said, I did let everybody go, and I thank God to this day that I let some of them people go, because it was just horrible how I was being treated as a patient. And I know many people might not believe that how is it every doctor is doing her like this, or every facility is doing her like this? Well, get on a blacklist and you'll see. You'll see. Once people spread lies about you and say that you've done something that you don't even know what you've done, you become a hit on everybody's list. Nobody wants to take care of the person that society is going against. So that's where my disparities are coming in there at, is that there's a debate with me on the inside. And this ain't them, but this is me talking as me. On the inside, the debate I have with me is that who do I trust? Who do I trust with my health care? Because I did do what they told me to do. Last year, I did what the nutritionist told me to do. I started trying to eat the way she told me to eat. She gave me some cheat meals for people who don't have, a lot of money to buy these expensive meats or quality meats and vegetables and stuff. She gave me some good tips and stuff. She was good at what she was doing. So, she was good at what she was doing. I just had a problem with one thing. One thing turned me against her. And that one thing I probably should not say, because I don't want to see other doctors doing it. But that one thing turned me against her, and I couldn't. After that, I was like, you know what? Okay. But anyway, I did trust her enough to confide in her that I had this issue. Okay, here comes issue one of why I'm not approved for the weight loss surgery. Issue one is it started all with the nutritionist. I felt like I could talk more with the nutritionist than I could my therapist. And I had to let the nutritionist know what was going on so that she would understand why I was eating the way I was eating. Now, I told the nutritionist, I said, I have a stomach condition that was only looked at one time in my entire life and never looked at again. And she asked what was that condition. And I said, I eat and I throw up. I eat and I throw up. I drink, I throw up. And this is every day. This isn't like no certain foods I eat or overeating. It doesn't matter. I can take like maybe 3-4 swallows of a drink. It's coming back up. And so I told her what I was going through with my stomach. I said, I've been like this since I was a child, since I was 7 years old. It was something I started doing because of emotional abuse and physical abuse at that time that I was going through. I was going through really bad, just childhood stuff. And ever since then, I never stopped. I started throwing up at 7 years old to protect myself. And then it ain't never stopped since. It hasn't stopped. I'm now 47 years old, and 40 years later, I'm still throwing up. The only difference now is back then, I was forcing myself to throw up. Now I'm not forcing myself to throw up. Now it's just happening. So that's one reason why I'm not eligible for the weight loss surgery. Now, the nutritionist referred me to another lady within the clinic, and this lady, she worked specifically on stomachs. She's the one that can tell, why you're not swallowing right, or why food is coming back up, and if you got hernias in the stomach and stuff. She's just a stomach specialist, okay? Now, I get down there, and the problem I had was nobody heard what I said, and that's why I didn't go back. I never went back to get my stomach examined, didn't go through with the x-rays and I was supposed to do ultrasound of my stomach. I didn't go through with any of that. They had set up the appointment, and I was supposed to drink this stuff and all that. And I'm going to tell you why I didn't go through with it. Because they kept putting the wrong thing on my chart. Why would I trust you with my stomach, with my body, and you don't even hear me when I say I'm not here for that? When I first got there and checked in, the lady said at the desk, she said, you're here because you have a problem with swallowing. I said, no, I'm here because I have a problem with throwing up. And I said, could you please change that in the chart so that they don't get me mixed up with somebody else that may have a problem with swallowing? She said, okay, I did it. So I get into the room where, the examination room, and a young black girl comes in and she says, okay, Miss Boughton, I'm here I'm going to do your blood pressure and all that good stuff. And then she says, so you're here today because you have a problem with swallowing? I said, no, was it not changed that I'm here because I'm throwing up? And she says, oh, well, no, I just assumed that you had a problem with swallowing. I said, I'm here because I've been throwing up. every day. I'm not here because I have a problem swallowing. I have a problem keeping food down. That's why I'm here. And I sat there and explained that thing to this nurse for about 2 or 3 minutes. And she said, okay, I'm going to change that and let the doctor know. Because I told her, I said, can you please straighten this out before it gets to the doctor? Because I don't want to be down here getting seen for the wrong thing. There's nothing wrong with my swallowing. I don't want to get in and I may have surgery and then they operate on me saying that I can't swallow when that's not the truth. The truth is I can't keep foods down. That's my problem. I can't hold foods down. And that's what the problem was. So, okay, that's the second person in that office that told me the same thing. The third person in the office, lo and behold, the old doctor walks in. Female doctor. And she looks at me and she said, hey, Miss Bowden, how you doing? And I'm like, I'm doing okay. And she said, okay, so you're here because you have a problem with swallowing? Can you tell me more about this problem you have with swallowing? I said, ma'am, I'm not here for having a problem with swallowing. I'm here because I have a problem with keeping foods down. I'm throwing up daily, multiple times throughout the day. 50 and up times a day. I'm throwing up. And I'm trying to explain to her this. And now this is the doctor. I'm explaining to her, how you going to treat me and you don't even know why I'm here and you're not listening to what I'm saying. I done told 3 people now that I'm here because I have a problem keeping food down. That's why I was referred to the stomach doctor. I forgot what the specialist name is, the correct term is for that. But she specializes in this condition. Oh, excuse me. Whew, y'all, sorry about that. Whew, that got bad. But she specializes in stomach disorders. And I have a stomach disorder that has yet to be looked at because she kept saying, and her nurse and her receptionist kept saying that I was there because I couldn't swallow. And that's not true. I was there because I couldn't hold food down. And they didn't want to change what I was telling them. And I said, you know what? You're not going to work on me. You can't work on me if you're trying to work on me for the wrong thing. How do they get that I can't swallow from I can't hold food down? Even after I done told 3 people, I told 3 of them that y'all got my records wrong. This is wrong. What if I have to go into emergency surgery and y'all are sitting here saying that I can't swallow when that's not true? My problem is that I can't hold food down. So I felt like they were trying to be funny. I felt like they didn't want to really help me. So I took my business up out of there. And let me tell any of you that's listening, anytime you feel like you're not being heard and they're not trying to act like they hear you, you have a right to leave up out of that office. That's your money paying for that. That's your insurance paying for their care. Your insurance is the one paying for you to be cared for. And here you got to deal with somebody that don't even hear what you say. So I told my doctor, I said I had a bad experience with her. No, I won't finna show up. Would you show up? I mean, just hit me in the chat. Let me know. Let me know in the chat or comment whenever you get a chance to hear this podcast. Would you show up to an appointment where they keep putting you down for the wrong thing? And she was already talking about that it might have to be some type of surgery or procedure, or it might not. I might not need a surgery procedure, but you can't do nothing to me until you first get my chart right. If you don't get my chart right, I'm not going anywhere. So she did write me out a prescription to go get my stomach looked at the other hospital. It would have been some gastro thing I had to do with ultrasound, and I would have had to swallow some stuff down, and they look all in my stomach. And I didn't follow through with that because, as I said, if one order was wrong, that's going to affect the rest of the order. How you might come looking at my throat and you need to be looking at my stomach. So why would I approve such bad treatment like that? That's why I didn't go through with it. So that's why I was turned down for bariatric surgery. The second reason I was turned down for bariatric surgery was because of a psych evaluation. You got to do some psychotherapy. And at this current time, I'm not in no mental health thing. I'm not seeing a therapist, a psychiatrist, or anybody at this time. And they need me to be, evaluated in order to get the surgery done. Now, from what I understand, the evaluation is to make sure that you can handle the change that comes along with it. They say it's a vigorous change, and you got to be able to handle the change that comes along with this operation to help you lose weight. And I've seen where people have to take all these medicines for the rest of their life. Well, that's what I'm trying to get away from, taking pills. You gotta take vitamins, and you don't got a choice really, because if you don't take this stuff, you're gonna be really sick. And so it's a big change. This isn't no small change like take the surgery and you lose the weight and then you feel good about yourself. It's a lot of people hating themselves behind that surgery. And I know for a fact it is, because I have spoken with a lot of them who actually turned out, they said, I liked it myself better when I was bigger. I loved myself then. I got this surgery. I don't know who I am. Now, I'm not saying that happens with everybody. Some people do gain their life back, and some people gain addictions from it, like alcoholism, drugs. It's different things that comes along with it. So you got to take this psych evaluation in order to get approved for it. I have not done that. I have not had therapy. I haven't been on the therapy. I think it's around 6 months. Because I told y'all I dumped everybody. I dumped the therapist too. The therapist kept trying to hold me back, and I couldn't go for that. She was trying to put me in places that I had overcome. I don't have a problem with my mama, with my family members, nobody. I don't got no passive aggression toward nobody, nothing. I don't got I have nothing but love for my family. And I'm glad that I took the time to sort out what I was going through so that I could come back and love them the way God intended for me to love. So I ain't had no problems in that area. But this lady, she kept trying to just trigger me. And it got to a point where I was like, you know what? And she didn't want to talk about anything that I want. The real stuff that I was trying to talk about, she kept brushing that off. So I was like, girl, I do not need you. Because right now, you acting like a girl. You got a degree, but your mindset is so childish. I'm not going to deal with that. So I had to let her go too. Now I know it seems like it's all me, but let me tell y'all something. Seasons do end. And that season was up. I endured that torture. That was mental torture right there, just being up under that woman. She was a nice, happy, bubbly woman, but she stayed in her own comfort zone. See, I didn't want the stuff she was on. That's not where I was hurting at. That's not where my emotional damage was at. That's not where I needed healing at. Because I had already surpassed all that. Been surpassed it. In 2020, that was it for that. But where she was carrying me, I didn't like it. And so that's why I left. I had a problem with her too. And I know some of you right now are saying in your head, well, you the problem. Yeah. That's what you're saying. But if you come live the life that I'm having to live right now, you would understand why I'm saying what I'm saying. If you ride with me for one day and see how people treat me, then you would see what I'm saying. You'd be like, oh God, she was right. She was right. And some of you know exactly who you work for and what you do to other people that are like me that have been put on this community watch list. Y'all terrorize us. Y'all terrorize us. That's what you do. You make sure that we do not fit in society. You stalk us around. All kind of stuff. Y'all, I am probably going to have to cut this short and call this for part 1. Or either y'all hold up. Let's take a break for a minute. I got to see what's going on. I'm going to play a song for you. Okay, y'all, listen, we're going to get back on this subject later on, and I'm going to talk with y'all later on it because my granddaughters had came up, and are you the only one? Shut that door, girl. Shut the door.
I was on water.
Anyways, y'all, we'll talk about it later on because right now, like I said, my granddaughter came in, and stuff like this is not child appropriate. All right, so peace, love, and happiness, and let that sink in what I have already talked about and how people do treat each other. I'll be back on part 2.
Major phone carriers make you sign contracts with rigid data plans to trap you into a kind of forced phonogamy. Sounds pretty insecure if you ask me. At Consumer Cellular, we believe in a more consensual and healthy form of phonogamy, free of contracts and more flexible to your data needs. This way, you stick around not because we force you to with contracts and fees, but because you love our phone plans. Like ardently love our phone plans. Phonogamously. Consumer Cellular. When freedom calls, we're here to answer. Call us at 1-888-FREEDOM.
At Grainger, we're for the ones who specialize in saving the day and for the ones who've mastered the art of keeping business moving. We offer industrial-grade supplies for every industry with same-day pickup and next-day delivery on most orders, all backed by real people ready to help. So you can get the right answers and products right when you need them. Call, click Grainger.com, or just stop by. Grainger, for the ones who get it done.